I'm sorry, you're the chair.
Yes, thank you very much, and I'll recognize myself for questions. I want to thank all of you for being here. This is an issue that our healthcare marketplace has struggled with for many years. And Dr. McDonough, I do want to come to you first, because in Tennessee, where I represent, since 2010, we have had 120 of our independent pharmacies close. And this is tragic. Many times that pharmacy is the only access point for health care in these communities. And to a pharmacy, when I go in and talk with these individuals, and I'm in each of our 95 counties every year, and they will talk about how horribly they were treated by the PBMs. So I'd like for you just to talk about, for just 30 seconds, about how growth and consolidation around this PBM model has strangled not only you, but other independent pharmacies.
You know, when we saw the chart that showed the $7.3 billion in profits that the PBM industry is making, I can guarantee you during that same time, from 2017 to 2022, we just saw our profits going down to the point where we have no profits. We're being squeezed. And that's very concerning to me, because when we lose that community pharmacy, whether it's in an urban area where they might be the community pharmacy for that area, or in a rural area that we're in, they aren't coming back. I've had so many mayors and city managers and towns come to me and saying, will you open up a pharmacy? I'm like, we can't. Yeah. We can't afford to. So it has had dramatic impact on us to the point where now we've closed a pharmacy and converted another one to a hybrid telepharmacy, and that's still struggling. And I want to make it clear, it's not because we're bad business people. I want to make that perfectly clear. It's because we are not making any money on the drug, let alone the services that we provide to the patient to ensure that patient is achieving a therapeutic outcome with that medication. So we're losing it twice. We're losing it on the drug side, and we're losing it on the service side. There's no way.
You're right about that. I want to talk about bad actors with Mr. Scott for a few moments. We recently had the Department of Commerce and Insurance in Tennessee do a report that gave us some really disturbing information on one PBM in Tennessee. And what they found was that they were forcing these independent pharmacies, the non-affiliated, to pay a higher inflated rate on over 550 drugs. And they profited more than $30 million through spread pricing. Now, this gets to my first point about those 120 independent pharmacies that we have lost in Tennessee. Now, this same PBM failed to reimburse 265 pharmacy claims within the legally set 7-day business day period. And that impacted 40 separate pharmacies in the state. You know, it doesn't take a lot to connect the dots on this, and there are so many examples of these egregious practices. For the purpose of this hearing, I've given you one finding from this report. And what we have seen is, you talk about transparency, we don't have it. And it is insulting to patients and to pharmacies and pharmacists and to these independent pharmacies. So talk to me about how a $30 million spread and delayed reimbursement for pharmacy claims meets the transparency standards you claim the PBMs are putting in place.
Thank you, Senator Blackburn. I can't speak specifically to the individualized example, but I can cite to another report that was recently produced by Dr. Carlton from the University of Chicago, looking at these questions and using the exact same data set that's been submitted to the FTC for their ongoing study. And the conclusion was that unaffiliated pharmacies are not being paid less than affiliated pharmacies.
Well, I will
And that
tell you in
practice-
Tennessee that is not the case. And if you would like to see the study, I would be more than happy to submit it to you.
I will certainly take a look at it, Senator. If I could make 2 quick points.
Very
This-
quickly, my time's expired.
The practice of affiliation is not unique. Hospitals, wholesalers, grocery stores, Amazon, others are all partnering with pharmacies in order to provide that efficiency of care. And the other is, this same point has been made a couple of times, paying pharmacists to be able to do more services for patients is something that we really strongly support, and there's legislation.
Do you support that like you support the hike in administrative fees that your pharmacies have put in place? They have doubled. Doubled? You've got administrative fees for prescriber education, medication adherence, data analytics, pardon me, and these have increased 51%, 3.8 to 5.7 billion in a 2-year period of time. If I had my way, I'd do away
Senator
with
Blumenthal.
PBMs.